So I was flying the flag for educators in the UKONS debate, and we know that currently cancer nursing is facing a lot of challenges. Part of this is because of the increasing complexity of treatments, interventions that we have, and also because of problems with staff retention, emotional burden, and resilience, really. So in the debate, I can see how educators can actually influence and help cancer nurses deal with these challenges in the workplace. So our experience as educators, we are nurses and we are also academics. So we are up to date with what's happening in recent research and also treatments. And really, this dual expertise that we have would enable us to help nurses. Cancer nursing is a fast-moving and really ever-changing specialty, and education really always brings us back to the basics and foundation of our profession and our specialty. We have to start from the basic, from the foundation. For us to develop really competent and confident nurses, we have to start right. And education plays a big role in that. I can certainly think of a few mentors and educators who really motivated me, supported me from being a newly qualified or like baby cancer nurse to become a specialized cancer nurse. And that's very important to have that support. And education really covers the knowledge, but it goes beyond the classroom. It covers skills and attitude. How do we respond to these challenges that we are facing? And that's very important in cancer nursing. We give a lot of positivity in an expertise that that gives us a lot of negativity, because patients are worried, they're very anxious. When they receive their diagnosis, there's a lot of uncertainty in it, there's sadness. We support families, carers. So as nurses, we really give a lot of that positives to make sure that we reassure them. We give a lot of compassion. And that can't be learned in classroom, but there is a role of staying in the classroom, knowing your theories, but also going out in practice. And we have practice educators who are supporting these nurses in practice. And that's something that you can't do when you're running around really busy, because you need time to think. And that's, I think, the beauty of education and the practice educators we have in practice. We bring nurses out of that environment, out of that busy, challenging environment, so that they can stop and think, what do I really need to be able to face this challenge in front of me, so that I can be more resilient. You can't do reflection when you're really busy, because your priority is your patient. Your priority is to make sure that you give good care. But we also need to look after ourselves, and that's where the beauty of reflection comes in. Looking back, how can I improve myself? What do I need? What knowledge do I need to be able to support someone who's receiving a new form of treatment? Our patients go on the internet, they research, they know more sometimes in comparison to the nurses looking after them. But that's a big challenge. We have a lot of treatments, immunotherapies coming in. Do we really know what these drugs are doing? How can we explain this to patients? And that links with patient information from the beginning of their treatment, when they receive the treatment, when they go out there in the community, when they become survivors, or indeed some of them face end of life. And that support is needed, but without us understanding the journey, having the knowledge about the treatments, about cancer, and how we can support our patients in managing their symptoms, in managing the consequences of cancer, then we won't be able to support them effectively. And that's where education comes in, and that's where our role comes in.